Hello, my name is Dawn Langdon and I'm the clinical project lead nurse for the Thanet Health Community Interest Company, leading the group clinical lead for the group consultations in Thanet Women's Health Hub.
Hello, my name is Nadine Saunders. I'm the facilitator in the group clinics, and also I'm a social prescriber and a lead care coordinator over in Kent, Thanet, Kent.
So we started the group consultations in Thanet due to a high demand for menopause support with limited primary care capacity. We had funding from the Women's Health Strategy in 2022, but it was non-recurrent funding, and we tried to look at the best way that we could use that funding in menopause care. There was a lack of trained clinicians in primary care, and workforce constraints meant there was just myself in the Women's Health Hub with a menopause qualification leading that service. And the idea was to really maximise the limited amount of resource, both financial and from a workforce capacity, to have the greatest effect for menopause, for patients that are presenting with menopausal symptoms in Thanet. So what we did with our group clinic model, the training hub funded training aligned with the ELC model. So both Nadine and myself had already accessed this training before we had the funding from the Women's Health Strategy. And without that funding, without that training, we wouldn't have been able to set up these clinics in such an amazing way.
Gave us the confidence, didn't it? I think after watching the training, doing the training, it gave us the confidence of how to lead it, and
So we were supported from a pilot programme in Medway South and Public Health because they'd already been leading group consultations, and we did a hub and spoke model. We did sessions on weekdays and Saturday mornings to improve access for the patients attending. We had GP referrals, self-referrals to the Women's Health Hub, and campaigns via social media, and the ICB also had women's health pages on their website. And the group consultations were led by myself with the support of Nadine.
I think the Saturday morning ones were really good, wasn't they? Because that we could target the people that were working, the women that were working that age group as well. And we made it a little bit fun as well, didn't we? We did it one morning on Saturday, it's Valentine's Day. We dressed up in red and white, and we got some biscuits and things like that. So we made it quite fun as well, didn't we? So it's a very relaxed atmosphere, isn't it?
Yeah.
Our group clinics.
So the impact of the clinics really, Nadine, we were able to access more women to support them. So in the 1.5 hours that we had a maximum of 8, because we, from experience, that was any more than that, and it was a little bit unmanageable. But so we saw those in 1.5 hours, when normally they would have a half an hour consultation appointment in an individualised setting. The outcomes were, feedback from the women was positive. Would you say?
Really positive. Yeah, really positive. One lady, for instance, she came in, the first time she came in, she didn't really lift her head up from looking up from the table, really. She didn't really engage very much. She kind of spoke, didn't she, in the meeting and things, but she wasn't very forthcoming, and she kept herself isolated a little bit. But then the follow-up in 3 months' time, and she came back, she was like a different person, and she was talking to the ladies, and she said she felt lost and broken, and now she can see light at the end of the tunnel, and she loved the group clinics and asked to come back again for her 6-month review, didn't she? And she was like a different lady. So yeah, and I think the help from the other ladies as well. She didn't feel like it was just her.
So it was obviously that peer support that gave them the confidence to actually talk, to realise there were other people with the same issues, and so they did engage within the group. I don't think I can honestly say no one ever left the group consultation So we had 100% of attendance and they stayed. They also got high quality patient care with regards to menopause support. So we empowered the women together from both a clinical and a psychosocial point of view. And we offered lifestyle as support, and Nadine was great at hosting patients from a social prescribing.
Yes, we did, yeah, quite a lot of social prescribing we picked up as well for counselling and all different things really.
And talking to the patients, we did a survey before they left, and it was positive patient satisfaction within the group, and they were asking when they could come back. And for us, for me personally, the job satisfaction from supporting these patients has been really high. I don't know what you think about that, Nadine.
Yeah, I do. When we first started it, we were both really nervous, wasn't we? We didn't know what it would be about. And also being the facilitator at the end of it, I always say to the ladies, what did you get out of this? Did you enjoy it? How did you feel about coming into the group? And all of them said they were really apprehensive at the beginning, but they really liked the group setting, and we haven't had anybody, like Dawn said, walk out of a group or decline to come back into a group.
So our next steps, well, hopefully we're going to get some more funding to carry on these group consultations, because it would be really sad if they didn't continue, because they've been very successful. So we're sourcing recurrent funding as we speak. We're promoting the model across Thanet primary care. I think we're the only the Thanet KIC are the only company that are providing a service in Thanet for menopausal patients in this setting. I don't think there's any GP practices that are doing it per se. So we're trying to work with these practices to perhaps embed this model in primary care, and we're thinking about taking it into one in particular to start this process. So we've managing to train and support additional local clinicians with ELC support if the funding becomes available, although I've just heard that we have some funding in the Women's Health Hub, from the Women's Health Hub strategy still available, so we can use that as a driver. And finally, what's the final bit of advice, Nadine, do you think, to others making the change?
Just do it. Definitely, just do it, because all I can say is, like I said at the beginning, we were really worried and apprehensive at the beginning, but definitely just do it.
And just finally from me, I'd just like to say just a little caveat. It was a privilege to support these women on their journey during their transition years to become the best version of themselves.